2026 meeting of the Mental Health and Recovery Services Board Planning and Oversight Committee. Roll call, please.
Mr. Brown,
Present.
Mr. Albright, Mr. Arnold,
Here.
Ms. Banks, Ms. Bell,
Present.
Ms. Carter, Ms. Crockett,
Here.
Dr. Elhai,
Here.
Ms. Friedman, Reverend Gordon,
Here.
Ms. Harding,
Here.
Ms. Howe, Mr. Lambert,
Here.
Ms. Mendoza-Locke, Mr. Ortley, Ms. Rodriguez, Mr. Salas,
Here.
Major White.
Here.
Alrighty. Thank you. Recognition of visitors.
Tina Mason, board staff. Stefano Galloway, board staff.
Lynette Hare, Neighborhood Properties.
And Ms. Andrews, neighborhood properties.
Paul Lewis Recovery Council, St. Paul Board, and NPI Board.
Thank you. Welcome. I'm sure you all had a chance to look at the minutes. If you have not, please take a moment to do so. But if not, do we have a motion to approve?
So moved.
Second?
Second.
Any questions? All in favor?
Aye.
Opposed? Any abstentions? Motion passes. All righty. Treasurer's report. Jenny.
The February financial statements are on page 7. February is usually a really quiet month for us, and that was the case. You'll see when you see February actuals were very small amounts. A couple things I do want to point out, local levy revenue, you see a significant variance there. Usually that slides in the last couple days of February, but this year it didn't hit till March. And actually when we did receive it, it's about $350,000 over budget. So you'll see that next month in the March financials. And then the only other major variance you see there is purchase of service expenses, and that's been trending that way. We're looking into some of the reasons. We think it's a combination of many reasons. And for February, there's a decrease in net assets of $240,000. And then on the balance sheet on page 8, not a lot of significant changes for February. The biggest is a decrease in cash, and that's just normal monthly payments. And then the monthly payments are on pages 9 and 10, and there's a motion on page 6. Pretty quiet, simple month, not much activity. But I can answer any questions anyone has.
Motion to approve?
So moved.
Second?
Second.
Any questions? Those in favor?
Aye.
Opposed? Any abstentions? Motion passed. Moving on to the next item, 120-day notice, appeal resolutions. Elijah.
All right, good afternoon, everyone. You'll find a series of motions on page 11 and 12 related to the resolutions to the 120-day notice appeals we received. So you remember last month, we issued a series of 120-day notices to all of our agencies. We received 4 appeals. The first one was from UMADAP. So you may remember our recommendation was to not renew the Safe Neighborhood Programs, which is a prevention program, due to several years of late reporting. We met with UMADAP staff. They discussed some new technology they've implemented to get more timely reporting, and they have now committed to quarterly reporting, which we're requiring of all the agencies. So we believe with this new technology in place, they will be able to report timely and accurate information. Additionally, we talked about the program in general and ways we can align closer with best practices in prevention, which they were on board with. UMADAP is historically a prevention agency, so their staff are certified and qualified to do that. So with that, in the middle of the page, you'll see a motion, which is really to approve the allocation for next fiscal year, which would resolve the appeal. And the next appeal we received was from Sylvania Prevention Alliance.
Hold on a
Yeah.
second. Do we want to take these votes? I think we should take these votes separately, yes.
All righty, for the motion for the UMADOT, there's a motion to approve.
Vote to approve.
Second,
Second.
any questions?
Do we have an idea the timing of the implementation of this new system in terms of the 2026?
Yeah, they've talked about implementing it now, so at this point forward, the reporting should be on time. It was a custom-built software for UMADOT, so they can report more timely.
Thank you.
I think my concern is that we propose not renewing the funding because they have problems reporting. We pull their funding and then they say, we're gonna be good at reporting all of a sudden. I'm not comfortable with that, but if you're comfortable with that, then I'm comfortable with it.
Yeah, that was my question, was when you met with them, were you convinced, or did they give you the information that you needed?
Yeah, so this is new technology that they haven't had in previous years. They also had, they have a new staff member on board who will be doing the reporting. There's been someone historically who's retired now, and so they have someone who I would, probably without giving too much information, I feel a little more confident in their abilities to use new technology than the previous staff member in place.
So you're saying technology and staffing has been enhanced?
Yes, and that the retirement with the person and implementing the new technology all kind of happened around the same time. And it kind of happened probably around the same time when our reporting was due. So now the new technology is in place, the new staff member is in place, who we have direct contact with about the reporting.
Have we received any reporting since this has been put in place? I know that we pulled, the funding or whatever, but have we seen any, at least like maybe one cycle of this being implemented?
Yeah, I believe we received the required reporting, but we haven't received any additional reporting because within our cycle, we haven't required any additional reporting.
So like, I'm assuming that the services is being done. The only technical glitch is the staffing person and the software. That was it, right?
Yeah, the only real glitch has been about the reporting. Our concern was not about if things were happening, like the service would be provided. It was really the fiscal year after fiscal year after fiscal year of late reporting. I mean, eventually we did get the reporting, but it was hard to report on that in a timely fashion to you all. And so if you look at the past two reportings, we did note that because usually, we're pretty flexible if it's a week late or if they communicate something, but it's been getting longer and longer. So now that they have this technology in place, we are confident that they'll be able to report in a timely manner. And we are definitely continuing to monitor their ability to do that.
That's my question, is that, we're gonna be revisiting this more often with this provider than annually, to keep a closer eye on it. Is that my understanding?
Absolutely,
Okay.
yeah.
So you're comfortable with?
Yeah, and I will say with the changes with this whole process, we'll have a little bit more ability to do things instead of waiting till the next fiscal year.
I call for the question.
Great.
Properly moved in second. All in favor?
Aye.
Opposed? Any abstentions? Motion passes.
Moving on, the next meeting we had was with Sylvania Prevention Alliance. This is a prevention agency, and they've historically done kind of two programs we funded. One program we recommended not renewing for next fiscal year, that was the Drug Take Back Day. That recommendation came from our need to kind of cut some costs, but also really the Drug Take Back Day is a national effort that's the responsibility of the Federal Drug Enforcement Agency. They've appealed it, but in their appeal, they talked about their ability to expand to a younger group for prevention. So they asked to kind of shift some of the money we would have given for the Drug Take Back Day to their normal programming so they can reach a new population of elementary school students. So they have the capacity to do this. Meaning they have the staff, and they are ready to do this. They have the infrastructure in place, and the community has asked them to do this. So with that in mind, we are recommending to increase their allocation up to 150, which is about 2/3 of what we gave for the drug take back day. So it's really not new money to them, it's just shifting to a new program and saving a little bit on our end while expanding their parent education and youth-led prevention programming to reach new people. So our recommendation would be to follow that and ultimately ending the drug take back day, their responsibilities with that, and shifting some up to that 150,000 for the parent education and youth-led prevention.
And the shift amount is 20, 21, 22?
Yeah.
Yep.
Yeah.
$21,000 or $22,000. So we recoup
10-ish.
10-ish, 11-ish, and
Do they already have a program in place then?
Yeah, they have programming. They serve a lot of high school students, but there's an increasing need to reach the younger population
So
with
this will be
prevention.
expanding a program that already exists?
Yes. Yeah.
But they don't do that already in elementary school or whatever
Correct.
age group they're doing, but they know how to shift it downward to that age group?
Yes.
So they have like
They have,
educational materials or whatnot
yes.
to shift it to that age group?
Yeah, they have the credentialed staff and the materials for that for elementary school students. So they have everything in place. Really, they've just been waiting on a funding stream, and they've been going for grants and things like that. But the availability of grants, as we've talked about, has been decreasing.
And they have proven successes, I guess.
Yeah, we've not had any real issue with them with reporting or their outcomes I can't remember a time when we had to discuss with them any concerns.
So this resolve the appeal?
Yes.
A question. So they in essence agreed with the reason for our 120-day notice. So they're not really appealing the withdrawal of the funds and this programming. They shifted the challenge to a request for additional funds and program.
I will say that they recognize the benefit of what they did for Drug Take Back Day. However, they understood the rationale we brought, and they still believe educating people about Drug Pack Day is important. They're just gonna do that as part of what they do. So we won't see like the same billboards and stuff, but they'll still be educating their parents as part of that parent education about Drug Take Back the day and the permanent sites. So I think your statement is fairly accurate. The appeal is about as the solution to the appeal was that shift, but they still recognize the kind of the value they brought to Drug Take Back Day.
Thank
I
you.
want to just add quickly, we don't typically say, oh, you don't want to use the funds for this, feel free to request a shift. That's not how it played out. It played out in conversation with them. So as we were talking, the conversation came up, actually, we could use the money for XYZ, and we as board staff thought that was appropriate.
Okay.
So they didn't come at us saying, I would rather use it for this, because we typically don't agree to that.
Okay, thank you for that explanation. I appreciate it.
And then towards the bottom of page 11, you'll see that motion, which, which will be zero funding for Drug Take Back Day, and then that increased amount for parent education and youth-led prevention for next fiscal year.
Right. Is there a motion to approve?
So moved.
Second. Any further questions? Those in favor?
Aye.
Opposed? Any abstentions? Motion passes.
And then moving on, Unison, they appealed 2 of their programs. We had recommendations to not fund next fiscal year. The first is recovery housing. This recommendation came after, they had a long period of operations without being certified, which prevented our ability to grant the money as we would normally do throughout the process. They have received certification. They've been certified for several months now, but because of the length of time, we thought, this can be operational without our funds. So they appealed it and really talked about how they had planned for our funds in this fiscal year and future fiscal years, and without a commitment from us, they may not be able to operate, or they'd have to discuss the feasibility of operating this long-term. They maintained it, believing we would be granting them funds. So without that commitment, they would have to discuss, is this something worth doing, or would we lose this recovery house? We know the importance of recovery housing. The amount we provide is about $53,000. So we discussed with them agreeing to, continue this into this next fiscal year. However, if we have opportunities for other funding, like we've received Department of Development dollars specifically for, which were federal dollars specifically for recovery housing, if we receive those funds, then they would significantly underspend our local funds. So we thought that was a reasonable to ensure that this program stays in existence, providing the recovery housing services for individuals. But if opportunities came out to use other funding sources, then they would use those other funding sources and not our local funds. And then the other program was data-informed prevention. There's been, we've been discussing with them the prevention program for a while now and needing to move to specific required prevention strategies. So there are about 7 recognized prevention strategies. 2 of them are required strategies. If you're going to do prevention programming, you need to do one of these 2 and then a selection of the other 5 that are available. Now, we've been working with all our providers because there's misunderstandings because of the prevention terminology is specific, but when you're talking about general terminology, it sounds the same and people take that to mean the same. I think a good example of this is education. If you see a commercial about talking with your kids about not doing drugs, you might say that is education. In prevention, that is considered information dissemination, which is not one of the 2 required strategies. So we worked with them to say, and they've been doing a lot of information dissemination and through marketing and social media, and we needed to move away from that. So in our discussion with them, we really had them think about what education strategy can you do that's going to be primary for this program and secondary, that information dissemination. Those like public service announcements, that it's good, but not a primary strategy. So with that, they've discussed moving to doing more evidence-based suicide prevention trainings and some evidence-based practices around youth vaping, which are significant concerns in our community. And they've reduced, they were willing to reduce the amount of funding for that to $125,000, which we had given them over $200,000 for this program. So we felt that that was a good resolution to this. It gets us to what we need with prevention, but also they recognize the importance that the importance that we've been placing on, you know, moving to those direct strategies to intervene, but also helping us save some money on the back end. So you'll see at the top of page 12 a motion that resolves these two appeals to approve funding for recovery housing and then funding of $125,000 for the data-informed prevention program.
Motion, is there a motion to approve? Second?
Second.
Any questions?
It should, well, maybe I just wonder, it doesn't mention the swapping of money if money becomes available. Is that gonna be written into the contract?
Yeah, well,
It's already written into the contract.
yeah.
Okay,
Yeah, our
Yeah.
money is,
always secondary?
always, yeah.
And we're already aware of the Department of Development funding that's coming, but we know that there's going to be a gap at the end of the fiscal year. So it's not gonna go all the way through the next fiscal year. And we know we typically blow through that money pretty fast. So we know they're gonna have a gap and use some funds, but it's very likely that they will not use this entire $53,000.
Regarding the prevention dollars, earlier it was said that you don't meet with the providers when we rescind funding and say, what are some other places where you can spend this money? But it kind of looks like that's what's happening here, that we met with the providers and we've looked at ways for them to still spend the money.
So, no, we've been meeting with them for the past 2 fiscal years about aligning it with primary prevention strategies. So Unison's been doing a prevention program for a long time, and it's over the years has shifted, especially during the pandemic, to more of that marketing, social media, creating commercials. Last fiscal year, we talked about moving away from that and providing more education. Education and prevention is a planned series with a group of people. So we've been talking about that, and they did a little bit more last year than they had previously, but there's a recognition of needing to move to that as primary, with information dissemination as secondary. So it's not, we didn't talk to them about saying, what could you do, really what could you do differently with this money? It's, okay, we need to move to a primary strategy of education. The other one's environmental, which is more policy work. That's a little difficult for us here. So within these strategies, you know, how can we move to that primary prevention?
And this was driven by us, the board. They didn't come to us and say, we want to do something different. We sent the notice to them because we needed their strategies to align. So we told them they needed to change. We do always appreciate the feedback from our agencies so we know what's going on in the community, but we don't just randomly change funding without reason behind it.
Thank you.
So does that also change the method of evaluation? Because clearly if you're talking about a marketing concept, data-informed prevention
Mhm.
is a lot different than evidence-based, so is that something built into it?
Yeah, we, as we prepare for the next fiscal year, once we get, you all approve this, we'll then work with them to say, okay, here's more specifics of what they're planning, and then how will we measure success there.
Good. Any further questions? Properly moved and second, all in favor?
Aye.
Opposition? Abstentions? Motion passes.
The final one is with Neighborhood Properties, and this is related to their dog care facilities program. We gave them a notice due to really financial and programmatic reporting. The gist of it, we've been confused with some of the reports we've been getting, and it seems like there's not always a match between finances and programmatic reporting. And at times, while we require quarterly reporting, they'll report, and then maybe a quarter or two later, they'll have to go back and fix things. So, that happens from time to time, but we've been seeing a pattern of that happening in that. So we met with NPI staff, and they discussed kind of staffing changes they've had. They have a dedicated finance person now who's kind of more taking the reins and closing out the books more in a more timely fashion, and working towards getting more accurate reporting instead of just estimates. In our discussion, it was recommended by NPI staff that we have almost a performance improvement plan, and part of that will be our finance staff meeting with their finance team about 30 days before the reports to answer any questions, make sure things are on track, and get more of the actual expenses instead of projected expenses. We felt that was a great way for us to work more collaboratively in getting the information we need in a timely manner, ensuring that when they submit, it's going to be ready for us. So with that, there wasn't this, and this is a little different because there's not money involved in this motion, but this is really about accepting that strategy as a way to resolve the appeal. That the recommended strategy that we're going to take to do this kind of quasi-performance improvement plan will resolve the appeal and get us that more accurate, timely information we need for our program, for finances and programming.
And the consequences for not accepting the terms, it doesn't impact.
Correct. Yeah. And I will add, so a few fiscal years ago, you might remember that I think the last 2 fiscal years, we've taken some money away because more people have been moving to the residential state supplement that supports them in housing. And we changed the allocation that they give for the subsidy for a group home to match more aligned with that residential state supplement, the RSS. So we've been working for probably the past 2 years, I would say, to get a true cost of what it is and how many people we can actually serve in this program. And I think we're at a much better place now than we were 2 years ago, because it was all up in the air. There were different amounts of subsidy that were going out, and so if you have a range of 900 to 1,400, how do you plan and how do you estimate how many people are coming on that subsidy? So I give this to say that over time we have a true cost, and we're able to now have a better number of how many people we can serve. And so this program is really putting people with no source of income into group homes so they can, you know, stabilize and live in the community. So there's not a financial impact in this, but to resolve the appeal, we wanted to have a formal conversation with them. And it's a little awkward element because Lynette's in the audience here. But we wanted a formal conversation so we could get this on record and a way to, so we're all understanding how we're moving forward with getting those accurate financial submissions to us.
And the need is so great.
The need is definitely great. We've, NPI shared that they've actually seen a double amount of referrals for people with no income. So more and more people are needing this level of care without a payer source.
Is it for me or Elijah?
Well, I don't know. You tell me. I guess not directing this necessarily to NPI, which I know is what we're talking about, but it just seems to me that as we move forward in these times of uncertainty and the need for us to, perhaps the need for us to look at tightening the belt, that it is even more critical for not just any one particular agency or partner, but for all of them to provide us, both in our best interest, in our stakeholders' best interest, in the community's best interest, and in their own best interest, to provide us with timely, accurate information that we need to have at our fingertips to make the decisions that we may be forced to make. And if they don't give us the information, we can't exercise our fiduciary obligations and make good decisions. So it becomes even more critical as we're looking to, you know, make good decisions for our community, for our stakeholders, and our fiduciary responsibilities for them to help us do so. And so I think just, you know, generally, we should all be on the same page with that. Am I correct?
Yeah, and we
Yes, we had
agree.
that exact conversation with NPI.
Yeah.
Exactly,
So again,
just
I'm
like
not-
that, yes.
I'm not, I know it's their
Yes.
Yeah.
report, but I just think in general, and I wanted to be short because that's how I'm thinking, that that's correct.
Yeah.
Yes.
And this is kind of a consistent conversation we're having with our partners, because it's not, is the work going on? Absolutely. You know, people are being helped every day, but tightening up the reporting, the financial reporting is, you know, a conversation we're regularly having with our partners.
Are you having that monthly pre-meeting with all of our persons or groups that we service? For example, UMADOC, would they not benefit from that kind of?
We're
oversight?
increasing our monitoring with them.
For
Yeah.
all of them?
With UMADAP in particular and NPI. Yeah.
I mean, it sounds like you're helping them draft the reports that they're going to then give you.
Our reports are prescribed.
Okay.
Yeah. So we tell them what we need.
It just makes sense to have a continued conversation so that you'll know if there's a problem before it actually becomes a problem.
And this, I don't know, maybe it's not enhanced reporting, maybe it's just more frequent reporting, but how much of more of a load is that for you?
So I
When we
was.
talk about, you
yeah.
know,
One of the changes we're making
capacity.
into next fiscal year, finances already requires quarterly reporting. And historically, on the program side, we've only required quarterly reporting if it was a new program or a program not on track. However, next fiscal year, all of our programs will be reporting quarterly. And I think that's gonna give us good information to help monitor, help keep things on track. You know, we do, program staff do meet with our providers very regularly. So we have conversations on what's going on, what are the barriers. We don't always have those solid numbers, but I think, you know, with this change, we'll have more of the analytical data to kind of support and drive more of the decisions we're making here. So I didn't answer your question. We do have capacity to do that, because that's what we need to be doing. And then you'll see that motion in the middle of page 12.
So,
Is there a motion to approve?
I move.
Second?
Second here.
Any further questions? Those in favor?
Aye.
Those opposed? Any abstentions? Motion passes. Elijah?
So moving on, you'll see the health officer designation. Obviously, this is something we do on a regular basis. We have 2 new health officers coming in, and then 4 renewals. The 4th one is on the top of page 13. We also, as we've committed to, provided those demographics for our system. In a meeting, you asked kind of more for a more dynamic view of instead of from where we started to where we are now. You can kind of see this in more of a spacing. And then the motion is actually on starts at the bottom of page 12.
And I'm sure you probably know this. Okay, so you have here the ethnicity demographics. When we're talking about mental health of folks who need this type of assistance, how is that comparable? Like, y'all probably know it, like, you know, how many white folks, Hispanic or whatever, receive these types of services? Because it really doesn't necessarily match, well, African American is a little low, and so is Hispanic, of the demographics of the community. It's a little low on that.
Yeah.
But what about when you talk about folks who need the service? How off is this?
So that's an interesting question, and we attempted to look at that. This is a challenge because all of these health officers is just part of their job. So technically, everyone they're seeing on a day-to-day basis might need a health officer evaluation. Or some are supervisors and they might just be called in because no one's available. So I think, you know, our kind of philosophy has been more health officers is better and increasing the diversity. So it's really hard to match kind of that. Does the diversity match the need by who needs a health officer evaluation? Because we have some health officers that they might not write an involuntary application for admission for years. Because they don't see anyone. And then we have some, especially in crisis, who might be regularly writing those. So that's kind of, it's kind of a dynamic thing to try to track.
Look, can I, to that point, the adult mobile crisis pilot, now this will be just related to the pilot, individuals who may get pink slipped. We will be able to provide you that data next year for that portion of it. Because remember, there's more to a health officer's efforts than just going out on a mobile crisis. They're throughout the system. But for the mobile crisis, next year, we'll be able to give you that data because it's a part of the evaluation report for the adult mobile crisis pilot project.
I guess for me, the diversity, and I think the request to have the demographics was not so much diversity for the sake of diversity. It was more diversity for the sake of, it's like there's gotta be a tie to a rationalization, a business case for why, the diversity is important, and it's important in part because of the population that's being treated. So the opportunity to get some information on that is important so that we don't lose sight of the purpose for which diversity is important and not just for the sake of diversity.
Absolutely, and I think that's why a lot of agencies will also not just have their frontline staff as health officers, it's these supervisors as well. So, if we have an African-American supervisor who has time to evaluate this person, they might not see them on a regular basis, they might not be their primary therapist, but there could be the opportunity to go and see, someone who kind of matches their background. So we have these conversations in our health officer advisory committee on a regular basis, and we're always looking for opportunities to say, does this make sense for them to go through the training and become a health officer?
Elijah, help me out again. With the health officer advisory group, is that a conglomerate of all the health officers, or is that board staff?
That is representatives from all the people who have health officers at their agency.
Okay. Thank you. Any further questions? All righty, Elijah, next item.
You can vote.
You vote on this motion?
We didn't vote on the health officer motion yet.
Not yet.
You vote on it?
Yes, there's your motion.
Okay. All right. Is there a motion to approve? Second?
Second.
All right, properly moved and second. Those in favor?
Aye.
Opposed? Any opposition?
Need a break.
Motion passes.
All right, moving on. We have a PATH match. So you'll remember the PATH program, the Projects for Assistance in Transition from Homelessness, is a program operated by Neighborhood Properties, and this is an outreach team that goes, engages homeless people, connects them to mental health treatment if they need it, and housing. So this is funded through the Ohio Department of Behavioral Health from a federal grant. Part of that federal grant is a match requirement, and they use our funding as match. So this motion you'll see here is approving that match so the application can be submitted. You'll also see, between July through December, they made contact with 111 people. They've enrolled 77 of those in behavioral health services. They successfully went through a performance improvement plan with the state, and the state has resolved that. They're on track to meet their outcomes. So we really don't have any concerns about bringing the recommendation to continue this match for the program. And that is that $59,888. And you'll see that motion towards the bottom of page 13.
So moved.
All righty. Second?
Second.
Any further questions? Those in favor?
Aye.
Opposed? Abstentions? Motion passes.
All right. in the home stretch. So this next project we're bringing is really around permanent supportive housing. We've talked about this with you all. We're at this point, HUD is deprioritizing this for next year, and we're going to be losing permanent supportive housing. Some. We're gonna be able to renew up to 30%, but it's not going to meet the level we currently have for permanent supportive housing. How that works out with everything is still being determined. What we need to do as we meet with NPI and the homelessness board is we need to have a better understanding of the people in permanent supportive housing. Some of them have been in there for years. Some of them have had a lot of treatment, a lot of support. Maybe they can move on to other housing. We don't know. So we want to understand this population better across 3 permanent supportive housing sites. MPI having the biggest site, but also Catholic Charities and Leading Families Home. They both have permanent supportive housing sites. So what we want to do is find an independent contractor who can go in and evaluate the independent skills of these households. So assessing things like activities of daily living, assessing how their mental health is impacting their ability to complete those and live independently. So with this information, we believe we'll have a better understanding of the population so we can better plan on how to meet the need that is coming. On how do we move people from permanent supportive housing to maybe a different permanent supportive housing if it's available, or a different type of housing, maybe LMH, maybe an independent, a private landlord, maybe a group home. This is all speculation. We don't know what this population looks like. So we're recommending that we bring on an independent evaluator, think like an occupational therapist, someone uniquely qualified to go in, assess their housing readiness, and give us, the evaluation so we can better plan. So we're recommending a project for 6 months with $80,000. We don't have an evaluator yet identified. We're working on someone. We think this is, there are options in our community for this, but doing all of those is gonna be a big lift, yes.
Does the ADL include, I understand the ADLs, and I'm assuming you're using like the Social Security ADL system, does that include the financial ADLs? Because that clearly, how are you gonna pay the rent? How are you gonna pay your bill? That's clearly another, so does that include that analysis?
Yeah, it'll be we're hoping for a comprehensive evaluation that can include that. I think that's a valid point. How, what are your housing options if you don't have any money, right? So yeah, we do think because some have been in permanent supportive housing for a very long time, some might be in a good place to move on. Some might have just met the criteria and really didn't need to be in that level of housing, or maybe they were better served by another level.
Sure.
Again, we're recommending this independent evaluator who can go in, assess these households, many of them with children. So we as a community can better plan on how we're gonna help, alleviate some of the problem.
Yeah. A question I had, how long has this program been going on?
Permanent supportive housing.
Trevor?
You guys have an idea?
Permanent supportive housing itself,
Yeah.
1988.
Yeah.
I'm just thinking because, with any plan, it's always good to go back and reassess. That's why I was getting to there. And then when you think about, and what areas, like neighborhoods?
Well, we're all throughout Toledo and Lucas County.
Okay.
And whether it's in one-person housing or with families throughout, we're in Spanish schools, mommy schools, Oregon schools, so all
Okay.
throughout a scatter site model.
Okay.
I think it's a great idea to do what you're doing.
Mm-hmm, I do
But
too.
have you considered looking, our community is not the only community with the problem. It's national, isn't it?
Yeah.
So, are there any other models beyond the state of Ohio we could look at and benefit from?
Benchmarking.
So let me handle that one. This is the first step. So the idea is to get an understanding of who is occupying those housing. And as Mr. Salas has indicated, what might there be, what financial options might there be? I think the second step then is to put a plan together on how those folks stratify through those various levels, and then how they slot into the various different housing that we have available, and then what might we need to create. And that is, I think, where we need to look at other opportunities around permanent supportive housing. The reality is if it didn't happen this round in the continuum of care, it's going to happen either in the next round or the round after that. It's not going away anytime soon. We are going to have 170 plus people, households, probably closer to 300 people. A third of those can remain housed, 2/3 of those will be without housing. And when you put 200 people out on the street, our community better have a plan for how to deal with that, right? This is the first step.
Exactly.
So Scott, nobody's ever done this sort of study, ever?
Yeah.
Not here. So the closest we've come was before me, 2008, we closed 2 group homes with 11 people in it. We sent in an occupational therapist to evaluate their ability to live independently.
Right.
Found that 10 of them could live independently, went back a year later and found that 9 were still successfully living independently. So that was the closest thing that we've seen.
No, I'm surprised because really you want to know what worked and what doesn't work. But now it's even more of a critical issue now. Yeah.
This is a great opportunity to
Yeah.
discover something new and great,
Yeah.
but it could be a national disgrace as well if we don't handle it properly.
Do we expect that within the 6-month period and for this dollar amount, that this task can be completed? I mean, or are we looking at, in 6 months, seeking to allocate more and more time? I mean, I just want to kind of feel that out.
I think we're looking at our options on who could possibly do this. So for example, maybe we're partnering with the University of Toledo with the university with an occupational therapy program where they send their students and monitored by faculty. One private occupational therapist would not be able to get this done. Are there groups of occupational therapy practices? We're exploring all those things right now. I think this is a good start. This does give a competitive rate for an evaluation.
I think the only thing that, when I think about this, is that when we start digging, I think there's gonna be so much more that comes out. And to look at it where maybe systems and policies need to be changed, instead of just, putting a Band-Aid and moving somebody out. What is the system and policy that needs to be changed so that this doesn't happen again? Or what's happening, is it more of an outcome of a deeper issue? And do we look at those? I don't know, but, yeah, I think I think what's going on is an outcome of a bigger issue, and definitely systems and policies should be reviewed.
I don't disagree with you, but whose systems and policies? Because we're talking about 300 people that will very likely have identified as chronically homeless. And as you know, homelessness is more than just a mental health concern, it's also a poverty
Exactly,
concern.
yeah.
It's many other things that
Right.
we do not influence in and of itself. But the data will be what the data, first of all these folks are gonna be in poverty. Let's just, I'll be surprised if we find one that isn't. So then what do we do with that data? And of course, our partnership is with LMH, the Homelessness Board, the Commissioner's Office, and others. But at this point, we don't know what we don't know. We can make some pretty good guesses, and yes, we do have a competitive rate with an evaluation. And we're
I'd be
putting our
interested
best
to-
foot forward
Yeah.
on it, just to say,
Yeah.
okay, we gotta do something.
Yeah, I know.
We
I
don't
would
know
just- I'd
everything
just be
right now, but
curious
we
to
gotta
see
do
what
something.
comes out.
Are the other entities financially contributing?
No, this was something that we stepped up to do because it's going to be mostly mental health disorders that are driving this population. And so we wanted the data. And I'm just, honestly, someone like the Homelessness Board doesn't have a discretionary income for this kind of evaluation.
I think that's great leadership on our part.
Hold that thought, because we're gonna have the next conversation.
So, in the middle, page 14, there's a motion for your consideration, that $80,000 for an independent contractor to evaluate these permanent supportive housing within the continuum of care between May 1st through October, the end of October.
So moved.
I have a question. So I'm assuming that the board staff have, you know what your metric that you're trying to measure, or whatever you come back? Because I'm thinking practically, from clients that I've had, are they unbanked? Are they functionally illiterate? Do they know how to even read English, much less other languages? Which are all functional issues that you can put them in the housing. They don't know how to pay the rent, electronic payment, they gotta get over to the welfare department to deal with the utilities. These are all, I'm assuming you have that sort of structure in place versus, well, we wanna look at policy, so it is what you're trying to measure.
So that is what the evaluation will tell us.
Right.
What these households, what is their capacity to do these activities of daily living, so they can maintain housing, or not. Because they may need to be in permanent supportive housing, and then that becomes a question, what is our community gonna do about that?
So right now, you don't know what you don't know.
Correct.
Basically, that's what.
Yeah. You asked me if this has ever been done before, and I gave you one example, but I actually forgot about a more recent example. Community members got together probably 5 years ago when the Lorraine Hotel closed.
Yes, oh, we were part of that.
You were part of that.
Yes.
We were right in the middle of it ourselves. And we worked as a community to identify the needs of all those residents. At the time, I think it was 36 residents at Lorraine Hotel, and work with them on appropriate placements elsewhere so that we wouldn't have that group who weren't going to go into the emergency shelter system at that time, not out on the streets. So we do have some examples of the very same folks coming together to resolve what is likely going to be a catastrophic issue in our community.
That would have been a good follow-up, because I know we filed a lawsuit to stop. I
Right.
think we just
Right.
bought time.
Right, you bought
It's gonna
time.
happen. It's just a controlled eviction. more
Right.
than anything. But that would have been a good example to follow up what happened to these folks. That's,
So we do have a first and second.
yeah, sorry, yeah, second.
Properly moved and second. Any further questions? Those in favor? Opposed? Any opposition?
Thank you
Abstentions?
for nudging us along. You're like, come on, move it.
Motion passes.
Well, thank you, Elijah, for carrying the water on most of this meeting, but this next one is mine. So the theme of today is housing, right? And we have an opportunity, but before I discuss the opportunity, I want to just provide a walk down memory lane, if that is helpful to us. So in March of 2024, we passed a new 1 mil levy. If you recall, we let a 1 mil levy expire, and we passed a new one, or 0.5 mil levy expire, passed a new 1 mil levy. During that campaign, we stated several priorities, including increasing services to youth and older adults, developing a law enforcement co-responder model, and increasing access to behavioral health services within the Lucas County Correction Center. They're starting to ring a bell to you. I think you were standing at the podium talking about a lot of these things, Pastor, right? We feel like we've met some of our priorities. Increasing services to youth and older adults occurred through the board's additional investments in treatment services. We developed a law enforcement the development of a law enforcement co-responder model is actually in process now. Shortly after we passed our levy, the Criminal Justice Coordinating Council actually got a federal grant, a Bureau of Justice Assistance grant, to develop a co-responder model. And so we were relieved of that responsibility of having to pay for it, use federal dollars instead of local dollars. That was a two-stage grant, planning and implementation. Planning went on a little longer than expected. They haven't spent as much money. They're about to launch implement the co-responder model now. And they have enough money that if they receive a no-cost extension, the program could be funded, at least the clinical side of it, through September of 2028. However, where we have fallen short, through no fault of our own, is through increasing investments in behavioral health services at the Lucas County Correction Center, the jail. And the reason for that is because through the evolution of provider services in the jail, it evolved from their physical health provider doing behavioral health services. However, that provider was not Department of Behavioral Health licensed to do that work. They had the independent licenses to do that work, but they didn't have the Ohio Department of Behavioral Health certification to do that work. Consequently, state law forbids boards like ours in funding agencies or organizations that do not have Ohio Department of Behavioral Health certification for treatment services. So we could not actually fundamentally give money for those behavioral health services. However, that money has been in our financial forecast for the last 2 years and throughout the financial forecast. And by the way, it will be in our financial forecast when you see the new financial forecast in May. Right?
Yes.
In May.
Yes.
There. I wanted to walk you down memory lane so that you understand that we had some commitments, and the commitment around the jail didn't pan out the way, jail treatment services didn't pan out the way we thought, but the intent is to jumpstart the care of those individuals that are going into the jail that are traditionally the most difficult individuals for us, our systems, to engage. Okay, so there's that part. So why are we talking about Mission Point? Mission Point is a permanent supportive housing project, collaborative project, that has brought together a private equity firm, Cherry Street Mission, LMH, and the Lucas County Board of County Commissioners to develop a 65-bed, a new build, a 65-bed permanent supportive housing unit on the ground currently owned by Cherry Street Mission, right across the street from LC4. So the new dog,
Oh, yeah.
right? So that strip of land that currently has the Key Bank kiosk, right there.
Okay.
Cherry Street and Lucas County, or Lucas Housing, what's the name of that? Lucas Housing Services are the co-developers. It's a $21 million project. They plan to close on all the paperwork at the end of June and begin construction, thank you. Begin construction. They were approximately, they are approximately $880,000 shy of their budget, capital budget. We were approached, well, I guess it was 1.5 million shy of their capital budget. We were approached by the county commissioner's office to see if we would be interested in sharing, splitting the difference with the county commissioners on that 1.5 to close the gap so that construction can start. This is a 65-bed unit. It has LMH commitment for 65 vouchers for that facility. We've also received a commitment that 50% of those vouchers will be dedicated to individuals with mental health disorders. The vouchers will be filled through the coordinated entry, which focuses on chronic homelessness. So it's an opportunity for us, using the $750,000 that we would have wanted to give for jail treatment services, taking that on a one-time basis and moving it over and providing it to Lucas Metropolitan Housing for the purposes of providing capital, closing this last mile funding, so to speak, for this project to proceed. I'm comfortable with making this recommendation because A, it's in our budget, it's in our forecast. It hits a population that is very similar to what would have been, and very likely appears in our Carnegie jail on a regular basis. It also provides a similar stable platform for those individuals to engage in treatment services. There will be no expectations of us providing continuing funding, either capital and or operational, and Cherry Street Mission will be providing the long-term supportive services out of their facility, which is right across the parking lot. So I'm going to stop there. I know this is a fairly non-traditional ask, but it does seem like a pretty strong opportunity for us to engage in a project productively and put it over the hump and meet some of what we know is critical need on housing for our populations on a one-time basis. So
Certainly maybe non-traditional, but when you think about the entities that have come together in a coalition to do this, and then a portion of that is mental health, I don't see how we can not be involved in it.
I have a question. So this $750,000, is this annually been a part of our budget?
it has been a part of our forecast.
Our forecast,
yes.
okay.
Because we would have held it waiting for,
So what happens if a new provider takes over the services in the jail and they are certified?
that's a great question. As you know, they are really looking at that right now, but that, as far as I'm aware, they are not looking at doing it within what is our current state fiscal year, which ends in June. So we're talking about money that's sitting in our financial forecast, ready to be allocated in this financial forecast.
So there is
this
no
year.
promise that those funds will be available down the road for jail behavioral
No,
services?
we've already committed that promise. All we're doing is taking fiscal year 20, if you approve, taking fiscal year 26 funding that we would have designated for jail treatment and giving it to the capital at the commissioner's office request. The $750 that will remain in our financial forecast into the future for those services.
Okay.
So my question is, they're gonna be Lucas County residents, and second, are they gonna be ZEV, Harbor Unison treatment source, folks that are coming out of jail in terms of housing?
So we wouldn't say that. It's coordinated entry works on a tiered system of first chronic homelessness. And if you're homeless in Lucas County, you are a Lucas County resident by our definition. So,
Yeah, not to throw the other counties under the bus, but
we're
you
well
know,
aware
in my
of the
experience.
Jesus, we're well aware of the dynamic on what happens when you are a resource-rich community and others.
Yeah, everybody shows up here.
Right. Right, we are well aware of that. The second of that is, frankly, most of these folks are gonna have a criminal history. And, you know, they just are.
Yeah.
So-
That's besides the question. I mean, my thing is that the folks that are residents in Lucas County that happen to be in that situation, that they meet the two criteria, the mental health board services treatment that this county provides, and then they're residents here, because I've had clients in the past where they just drop them off, the parents, downtown Toledo, we take care of them.
Okay,
That's
so
like-
that when you look at the definition of chronic homelessness, that population that you just described will not meet the definition. So these vouchers are designated, LMH vouchers are designated for individuals with chronic homelessness for this specific program.
So LHA has control of that, okay.
Yeah, and I mean, $750,000 is a lot of money, there's no doubt about that. But it's a $21 million project, right? And we're coming in at the last minute. Those conversations have already been discussed. We were lucky to confirm in writing that at least 50% of those vouchers will go to individuals with mental health disorder. My guess is it'll be probably closer to 100%. And so I'm kind of looking at this as a win.
And you were approached, we were approached.
We were approached, yeah.
To help them out.
There was nowhere else in the budget that the commissioners could find that 750.
That is something you'd have to direct to the commissioners.
I'm just,
My question is, not saying that it's not good, but, you know, we went to the voters and we told them that we were going to do, 1, 2, 3. So, and I'm not saying that it's not tied, but how off is it and how hard would it be to explain that we stayed on course and we did what we kept our word, I guess is what I'm saying.
Well, I will say to you that we will keep our word.
Yeah.
And while this doesn't hit that priority, we can spend this money. We have discretion to spend this money the way we choose. And we are not giving up on what the intended purpose was.
Yeah, that was my only thing, is that, you go back, we ask for more money, and they come, well, you didn't do this, this, and this, and so.
And
that
as
was
I
all.
understand it, you're saying this is only for this fiscal year, not
Correct.
going forward.
Correct. And jail treatment services have been occurring. So, yeah, it is a change, there's no doubt about that, but it is also an opportunity, and we all talk about market rate housing and not enough housing, and this is an opportunity to collaborate, as unplanned as it is, let's just keep it real, unplanned. But this is an opportunity to come in at the last moment and say, okay,
Scott, they need us more than we need them on this one. They really need the money to get over the hump, as you said, right?
I don't know that to be true, but I'll take it if you believe it.
I'm not saying that it's not good. I was just, my question was to just, to make sure we're
Yeah.
doing what we're supposed to do.
What
Because
happens to money?
there's still time for us to do what we intended before
Absolutely.
the next levy.
Yep.
And before we go
Absolutely.
back to our voters.
Yeah.
Because this is, my answer is absolutely yes, we should do this. So, but I have the same concern of going back to the voters. And you probably can't answer this question right now, but, so if that treatment is happening, so you're saying it is happening?
It is happening, yes.
So who's paying for that now?
County commissioners, because we can. And by the way, we won't cover the full freight of it anyway. Once we can. And we have been working with the jail staff in charge of that contract and immediately informed them of, hey, this is a situation here. And we informed the commissioners of the situation as well. This occurred, we won't be able to follow through on our commitment to you all, to the commissioners for this because of this. And we actually tried to get state law changed so that the provider could use a different certification to be grandfathered into the process. And we didn't have support from the State Department of Behavioral Health. We've been working this angle for a couple of years, since passing this levy. Yeah, it's something that I think everybody wants. Everybody wants a certified behavioral health agency in the jail. And my understanding is the next, whatever the next RFP cycle looks like for the jail provider will include a mandatory language that they either are certified or become certified.
So, this is what I'm not certain that I understand. So, once we pull this 750,000 that's in our forecast out, and we do the next budget, are we putting another 750,000 in the forecast?
Yes.
Well,
Yeah, we have 750 across the board for the next 5 years.
Right, so there's 750 already in our forecast for this fiscal year and each fiscal year going forward. So this fiscal year, if you don't do this, will just be non-allocated, it'll just stay in our undesignated fund balance. Going forward, this project is not going to continue. However, we have the 750 in the forecast for jail treatment. Does that clear it up?
so,
When
yeah,
does
so
the
we,
fiscal year end?
June 30th.
so we refill the,
Yes, the funds are already there. I mean, and if you want to think of it as not replacing this project for that project, we have funds available. Because we're not doing XYZ, we have funds available. It's easier to think that way.
so this is really, we're allocating the funds for a worthy project that's going to benefit at least an overlap of the community that we committed, but we're doing it because it is impossible for us to fulfill that commitment at this point because of state law that is making it impossible.
And the request from the commissioners, because technically we would have given the money to the commissioners for the purpose of providing jail treatment services. They recognize we can't do that, so they requested, can we take this money and use it here for a similar, different but similar population? I mean, the bottom line to all of this conversation is if you go back to look at our financial forecast, and it says at the bottom right hand of your consolidated balance sheet, 18,069,109. If you approve this, that number will reduce by $750,000.
So just getting back to what Ms. Hoffman said, because a year from now, oh, you have a designated $750,000. As I understand it, this situation is a one-time deal. The next year is, oh, you have another $750,000 based on the 5-year projection that you put in there, that they don't come back and say, hey, now we need part of that money for something else that kind of goes with what my colleague here mentioned. Just to make sure that a year from now.
So I'm not responsible for their behaviors, so let's, whoever they are in that grand scheme of things, but if your point is are we kind of setting a precedent?
Right.
With these funds? This is why I put in the motion, or in the, I was insistent on one time. Because we did go,
Very
and
similar
we
to
did.
what we did with the Warren project.
Yes.
We put in $220,000 as a one-time
Right.
contribution to the capital stack,
Yes,
and that's all.
that is correct.
I have one question.
Yes, sir.
The language says, I see youth and older adults, but then I hear folks coming out of the correctional process.
They are independent priorities. So services increase to youth and older adults, creation of a development of a co-responder model,
Okay,
and.
so there's 3 different buckets.
Yes.
Got it. Okay, thank you. That was saying, okay, where did the youth going? Got it. I understand now. Thank you. All right. Motion.
That's a different project.
Got it. Is there a motion to approve?
So moved.
Second?
Second.
Any further questions? Those in favor?
Aye.
Those opposed? Any abstentions? Motion passes. All righty, moving on to open session.
A lot going on in government. I'll be brief. In all my days of attending public meetings, and that ain't no small amount of days, I've never seen anything like this current city council budget process. All through it, every attempt was made to keep everything secret. So they did have a 2 p.m. meeting last week, which was the 31st. They had to get it passed. And with great secrecy, that they passed this. As soon as I got my grubby little hands on it, I was showing it to people, but nobody seems to know anything about this. Like just last night, I was at Sanger Branch Library, and they had a bunch of presenters about, rental and assistance and stuff like that. They didn't know anything about this. The Tenants' Rights Council, it's a $108,000 cut. Some of these are ridiculous. I mean, the sheriff's deputies, or not the sheriff's, the Toledo Police will lose $32,000 in their Narcan. I did talk to the chief. He said he's going to try and find some other funds to replace that. The fire department, the physicals that they give to the people who both, the dive team that go into river look for bodies, or the hazmat team, that's been canceled. That's $91,000 there. That doesn't seem like a good place to cut corners. But what's done is done. This has been passed, and now over the next year or so, we'll hear a lot about this, but it's finished. City Council will have a meeting on Thursday, April the 16th at 4 p.m. Zeph Center will be presenting on their crisis response team and youth response. Tomorrow, the meeting once again of the, what do we call it, Lucas County Children's Services Board, Child Protective Task Force, whatever it's called. This has been meeting for about a year now. They meet every other week. In the beginning, they would have a regular meeting, and then they would break into groups with one on one side of the room, one on the other side of the room, and sometimes one side of the room would be shouting, and the other people on the other side would say, hey, we can't even hear ourselves think. So what they've been doing is over the speakers, they've been piping in soft music, soft jazz, easy listening, lots of keyboards, and it seems to be working. So their meetings are going much more smoothly now, and I'm told by the county commissioners the report will be in May, and it will be voluminous, and it will make a lot of people unhappy, but there's going to be a whole bunch of recommendations in there. And the county commissioners are on record saying we will respond to every one of them. Let's see what else is going on. You might have seen they didn't meet this week. County commissioners met last week. They are once again advertising for the healthcare services to the jail. Briefly, this used to be done by Unison, and everybody seemed happy with it. And in June of '24, they announced with great fanfare they were going with Vital Core and said this is going to be great and it's going to save money. And then in November, they said, oops, we didn't give them the correct number of inmates they'd be serving, so let's give them another $498,000 and that'll make everybody happy. I remarked to them, it doesn't sound like you're saving too much money to me. So they did approve the first renewal option last December, and now they will once again issue an RFP for comprehensive health care services for incarcerated individuals. I hope this isn't going to be a repeat of the last time. And finally, the Plan Commission will meet a huge agenda on the Thursday at 2, and there will be a daycare at 6118 Secor Road. What is it? There's going to be a very large charter school. It's called Oakmont Education. They're from Akron, and that's going to be at the corner of Glendale and Byrne. 2 scrap yards, always controversial. One at 5400 North Detroit and one at 4103 LaGrange. Both of them, the staff are recommending approval on those. I don't know if there are any neighborhood groups active or whatever, but they did save the most controversial for last. They will debate on Thursday what kind of trees can be used as shade trees along city streets in Toledo. And I was shocked when I saw the list and I saw that only the male ginkgo tree is allowed in Toledo. I did my homework. I thought this is, shocking discrimination. The female ginkgo tree, it's native to China. It's also known as the maidenhair tree, not a politically correct sounding name, but it produces a fruit that smells really, really bad and nobody likes it as much. So I did caution the security guards down at the One Government Center that on Thursday, you may have protesters show up thinking this is a discriminatory practice, but they have a very long agenda and they will approve that hopefully on Thursday. So that's briefly what's going on at One Government Center. Thank you.
My colleagues, please respond to my correspondence if you have not already done so. If there's no further action before this board, we stand adjourned.
Let's just see if anybody else.
Any other?
Doesn't look like it.
We stand adjourned. Thank you.
Hit it. It's the one benefit you get. Hit it.